Check, check. Just test the YouTube.
And welcome to the New York City Health and Hospital Fiscal Year 2020 virtual annual public meeting for the Borough of Queens. Before we start the formal program, I would like to call to your attention that we have interpretation services. If you require these services, please call 212-788-3359 for Spanish, Mandarin, and Bengali. My name is Helena Arteaga Landaverde, board member and Queens City Council rep. I want to thank you for joining us tonight, and I would like to introduce the other board members that are here with us as well. Dr. Jose Pagan, board chair. Robert Nolan, City Council rep for the Bronx. Benny Mona, Peña Mora, Frida Wang, Sally Hernandez, Anita Kawacha, and Dr. Mitch Katz, President and CEO of Health and Hospital. Also on our panel, we have Andy Cohen, Senior Vice President, Interim General Counsel, and our moderator for this evening. Colicia Hercules, Secretary to the Corporation. And on behalf of the board, I would like to extend our thanks and acknowledgement for the leadership at our Queens facility. Israel Votra, CEO of Queens and Elmhurst Hospital, and all the dedicated staff for providing excellent service to our public health system and the people we serve in the borough of Queens. And to all of you here tonight, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. And now we'll turn over the microphone to our President and CEO, Dr. Mitch Katz, to continue his remarks.
Thank you so much. I am Dr. Mitch Katz, and I'm the proud president and CEO of the New York City Health and Hospitals. On behalf of the board of directors and our dedicated workforce, thank you all for joining us for this virtual annual public meeting. We're deeply appreciative of the commitment to public health that you show by connecting with us tonight, and we look forward to your comments and concerns about the current and future state of New York City's essential public health care delivery system. As the safety net for all New Yorkers, our commitment is very strong. Last year, we provided more than 1 million New Yorkers with care, of which 375,000 were uninsured. We provided 5.1 million outpatient visits. There were approximately 152,000 patient hospital discharges, and we were happy to bring 15,700 newborns into this world. Of course, the most dramatic event of the year was our response to the COVID-19 pandemic. I'm so grateful and proud of how well the healthcare heroes across New York City Health and Hospitals performed, and that was nowhere truer than in the borough of Queens, which was hit so very hard by this awful pandemic. We're tremendously saddened by all of the lives lost to this pandemic, particularly the members of our workforce. We'll always remember their sacrifice to care for sick patients all through the pandemic. As we continue to respond to this unprecedented global public health crisis, the safety of our staff and patients remains our first priority. We're proud that while the healthcare systems in Wuhan, China, and in parts of Italy collapsed, we did not. Even though our public hospital infrastructure is aged, our resources are limited compared to some private hospital systems, and the needs of our patients, even in non-COVID times, is greater due to the effects of living in poverty, institutional racism, poor nourishment, chronic stress, and higher prevalence of chronic disease. Not only did we meet the challenge of the patients coming to us, but we accepted transfers from several independent hospitals that became overwhelmed at a moment in time. We were able to do this because of the transformational work we had done over the prior 2 years and our smart investments to expand in telehealth services, to adopt a unified electronic medical record system, to hire more nurses, to launch a new interfacility ambulance transport system. That's what got us through the pandemic. We began our planning response early before there was even a case. Even so, we never could have guessed that in 6 short weeks, we would triple our ICU capacity from 320 beds to over 900 beds. We answered the anxious calls of more than 80,000 New Yorkers with a real live physician or nurse practitioner or physician assistant answering their questions. Within a week of community spread of the virus, we converted all routine face-to-face visits to televisits or scheduled telephonic visits. We handled 13,000 patient messages over 6 weeks. To protect our heroic workforce, we created safe and supportive environments, prioritizing supplies and equipments and the needs of our staff. We provided relief to many frontline clinical staff by adding temporary supplemental staffing, including 4,000 nurses, 500 other providers, 250 environmental health workers, and 200 plus ancillary personnel. Through persistence and hard work, we were able to get the necessary PPE to allow for a 600% increase in demand. We protected our elderly and frail in our long-term care facilities. Our behavioral health and Helping Healers Heal teams worked to provide emotional and psychological support to our staff, which had to be heroic despite the tremendous challenges of this pandemic. And thanks to the generosity of New Yorkers and people across the nation, there was an outpouring of financial support for our staff, which we used to lighten the load with free hotel rooms, 3 meals a day, free taxi rides, childcare, extra scrubs, groceries, and even Girl Scout cookies. Thanks to the health professionals of New York City Health and Hospitals, more than 8,365 New Yorkers with COVID recovered in our hospitals and returned home. Many New Yorkers avoided healthcare during the surge, and now we are working hard to make sure that people feel comfortable coming back to our facilities, knowing that we are practicing social distancing, that we screen people on the way in, that everybody is required to wear masks, and that we have made engineering adjustments to make our facilities all safer for people who need our care. We are playing a central role in New York City Test and Trace Corps, which is the nation's largest testing and contact tracing initiative to fight COVID. When we took over, we had a markedly higher seroprevalence in New York City, and we've been able to consistently beat that down to a seroprevalence of only about 1% of all coronavirus testers being positive. We work hard to make sure that people are able to isolate themselves in their homes and thereby not expose others. We bring them groceries and their medications and do whatever is needed. We also recognize that many people who have survived COVID still suffer from the sequelae of the disease. They have side effects, symptoms like fatigue and anxiety and a variety of other pulmonary and gastrointestinal issues. We are caring for them now, and we will also be doing so in our 3 COVID centers as we open them. Our chief mission to bring affordable quality healthcare to every New Yorker has never felt more urgent. And so we're very grateful to the support of the mayor and the community partners in reopening NYC Care. So now the program is available citywide, and we're determined to make sure that everybody has the care that they need. I'm proud to have supported our staff who joined the White Coats for Black Lives movement. Part of our COVID centers is recognizing the disproportionate harm experienced by communities of color in New York City. We recognize this as a awful disparity and seek to make sure that people of all races and ethnicities at all income levels, regardless of immigration status, regardless of sexual preference, gender, religion, have the care they need. That is our commitment. That is the proud tradition of health and hospitals. Despite our focus on COVID, we still managed to achieve a variety of other milestones this past year, including opening up a new Pride Center to care for LGBTQ adolescents. We expanded Express Care and online visits. We enhanced services for substance use disorder. We improved services for people with chronic diseases. We expanded access for patients with disabilities. We launched peer-to-peer telesupport for Metro Health members. We expanded our arts and medicine program. We developed population health strategies to better serve homeless individuals. We helped our patients address food and housing insecurity. We launched reentry programs for those who are justice involved. We began plans to open outposted therapeutic housing for incarcerated individuals. Our facilities continue to win numerous awards for the excellent care that they provide to our patients. Health and Hospitals has a very proud tradition. We will always be here for those people who need us. We will care for all, making sure that at every moment we're enhancing the dignity of every human being. Thank you very much again for being with us, for listening to this report. We look forward to your comments, and I'm happy now to turn it over to our General Counsel, Andy Cohen, who will review how we will do the rest of the meeting. Andy?
Thank you, Dr. Katz, very much, and good evening, ladies and gentlemen. For those of you who have just joined the program, I just want to remind you that we have language translation services available in Spanish, Bengali, and Mandarin. If you require these services, please call 212-788-3359. You also have 10 more minutes to register to provide testimony this evening, and you can do so by calling the same number, 212-788-3359. So I want to call us for the remainder of this program, which is the 2020 public hearing for the Borough of Queens, which we are conducting virtually this year in the period of COVID-19 public gathering restrictions. This is the third in a series of 5 meetings that we conduct annually across the city's 5 boroughs. The purpose of the annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, as Dr. Katz just did. And the second half of the program provides an opportunity for the public to present oral or written testimony concerning New York City Health and Hospitals' performance. All public testimony that we hear or receive this evening will be transcribed and forwarded to all the members of the Board of Directors for their consideration, in addition to many hearing it live this evening. I'll be moderating the balance of tonight's meeting, during which members of the public will be sharing your comments. And at this point, I just want to give you a moment or two on rules for the road for this testimony. The most important point for you to understand is that the members of the board of directors who are here to listen to you, not to engage in a dialogue. There will be no question and answer. You will have 5 minutes just to present your testimony, which will be considered by the board. Each registered speaker will be allotted 5 minutes of speaking time. On your screen, you'll see an electronic timer that will provide warnings about the expiration of your time. It will start with the light green. When it turns yellow, that indicates that you have 2 minutes remaining in your allotted time. A red light will signal that your time has elapsed, and about 10 seconds after that, it will begin to flash, which means you've exceeded your time, and I will, at that point, interrupt you and ask you to finish your thought and move on to the next speaker. If you don't complete your comments within the allotted time, don't be concerned. You can submit a written statement that includes the remainder of your remarks. And again, call that number 212-788-3359 for instructions on how to submit the remainder of your testimony or any written testimony that you want to provide. Last point. I will be calling on speakers from a list that I have here that will be updated at 6:30 if anyone has added themselves to the list. Some of the names I will be seeing for the first time. If I mispronounce your name, please forgive me in advance, and please do correct me when you first begin to speak so that we have the proper pronunciation of your name. So thank you very much, and we will now jump in and hear from the first speaker. The first speaker is Assemblyman David Weprin.
Good evening.
Thank you.
Can you hear me?
Yes.
Yes.
Yeah. You know, I just wanted to say I really want to commend Dr. Katz and your entire board and the entire New York City Health and Hospital system for the tremendous work you did on the front lines during this unprecedented pandemic. And you really were on the front lines. I am so proud to represent a very diverse district in Queens. And you're really the safety net hospital for my constituents, because we have about a 60% first generation immigrants in my assembly district, and which includes, which I proudly includes New York City Health and Hospitals Queens, which is in the middle of my assembly district. And I really want to recognize the great work of Dr. Israel Rocha as CEO, not only of New York City Health and Hospitals Queens, or what I still call the Queens Hospital Center, but Elmhurst Hospital as well. And I was on the front lines with Mr. Rocha so many times during the pandemic, providing supplies, doing outreach events, providing food for those in need. And it's really, it's beyond belief the amount of work that everyone did from the Health and Hospitals family during this pandemic, which is still going on, obviously. Thank God the numbers have gone down significantly. The curve has been bent, but we obviously stay, keep an eye on social distancing and wearing masks. But I just really wanted to say that I'm so proud to represent what I consider one of the most outstanding hospital systems in the world, and really do such a great job. And particularly, I can speak for Elmhurst Hospital as well as Queens Hospital Center. Thank you.
Thank you.
Thank you so much for your testimony. The second speaker will be Assemblywoman Alicia Hindman. Okay. Apparently the Assemblywoman isn't on the phone at the moment. We'll move to the next speaker, Matthew Kusher, Clinical Director of Plaza del Sol Family Health Center. Matthew Kusher, no. Okay. Is he speaking? Hold just a moment. I'm going to call the next speaker, and then immediately I'll go back to Matthew Kusher. So the next speaker is Salua Beda, the cab member from Elmhurst.
Good evening, buenas tardes. My name is Salua Baida, and as I complete my term as a CAB member and as the chair of the Legislative Committee for the Community Advisory Board of New York City Health and Hospitals, Elmhurst, such a long name, I have so much to share with everyone about how grateful we are to Elmhurst and the system, about how important our community is, how important our funding is, and how supportive our elected officials have already been, and how we will continue to look to you and to count on all of you. So I first want to say how grateful our community has been to Elmhurst Hospital. It has cared for us during this COVID-19 pandemic, as we've all seen. I so appreciate the heroism, the sacrifice, the incredible dedication of our one-of-a-kind Elmhurst staff, and I'll continue to do all that I can to champion their work and to get through this difficult period. And regarding COVID-19, this pandemic has served as a stark reminder of the vast inequalities within our society, especially when it comes to race and social justice, and how these inequalities inevitably play out in the healthcare system. So because of our country's inequality over centuries, Black, Indigenous, and other people of color are more likely to live in areas with more disadvantages, like toxic pollution, like less nutritious food access. And so we cannot claim surprise later when these lead to worse health impacts when it comes to asthma, to cancer, and to so many other health conditions. So now more than ever, I would hope that the safety net hospitals out there, like Elmhurst, which are the hospitals that proudly serve large populations of people of color, of immigrants, of the working poor that make this country work, I would hope that these hospitals will receive the resources that they need to help counter the disparities that are literally putting people's lives at risk. So thankfully, some of our leaders have already begun to answer that call. And as outgoing chair of the Legislative Committee of the CAB and as a Latina, I am thrilled to share with you some of the support that Elmhurst has already received from our elected officials and their representatives. So just this past February, our CAB invited a number of elected officials and their reps to our annual legislative lunch. And so there we heard from our excellent leadership from Elmhurst CEO, Mr. Israel Volta, as well as our medical department chiefs, about the critical need that Elmhurst has to receive funding in order to modernize and to update equipment to take care of patients, and particularly of cancer patients in our community. And so I'm so pleased to report that Elmhurst has received funding from Acting Queensborough President Sharon Lee to acquire a linear accelerator system, or LINAC, which is for external radiation treatments for patients with cancer, as well as new equipment for the hospital's radiology suite. So acquiring this equipment will allow Elmhurst to develop a new Advanced Oncology and Blood Disorder Institute. And this is something that is vital given the high rates of prostate cancer, colon cancer, and other cancers in our community. And I also want to thank our City Council delegation for allocating funding that will be utilized to renovate vacant space on the hospital's 5th floor. And that will be a fully functional 30-bed medical unit. So this additional space will give Elmhurst the flexibility that it needs to treat patients and weekends during the COVID-19 crisis, which is just fabulous. And I also want to thank Assemblymember Jeff Aubrey for sponsoring Elmhurst for a state grant. This state grant will begin a mobile clinic program. So doing this type of grassroots outreach, this type of health education will be such a great benefit to the community. And once again, this hospital finds thoughtful and innovative ways to meet the healthcare needs in our neighborhoods to combat those chronic conditions like diabetes, like blood pressure, like heart disease, and to meet the patients where they are. And lastly, I want to thank all of our elected officials at the federal, at the state, at the local level who have worked tirelessly to support Elmhurst during this unprecedented COVID-19 pandemic. By connecting the hospital to donors who generously sent PPE, they sent food, supplies, equipment, and so many other types of aid, and to everyone in the community who did so as well. Their advocacy of Elmhurst has always been appreciated, but it has been exceptionally valued as the hospital has fought to care for a hardworking community that was devastated by this virus. So to all of you who have helped in so many ways, my fellow CAB members and my fellow community members and I, we thank you, and we hope that we can continue to count on you. So thank you, and happy National Voter Registration Day.
Thank you so much for your comments. The next speaker, we're going to return to Matthew Kusher, Clinical Director at Plaza del Sol.
Right now?
We can hear you.
Okay, excellent. Good evening. Thank you for the opportunity to speak tonight. Our health center, Plaza del Sol Health Center, is located in Corona, Queens, the heart of this epidemic. We are the initial safety net for Elmhurst Hospital, and then Elmhurst is our safety net. We work in conjunction with them. We take care of the same patients, a portion of what Elmhurst is tasked with taking care of. We take care of mostly an undocumented population of Latino immigrants and their families. And we do so with the knowledge that we can only do so much in this pandemic. And what I mean by that is this. While we can provide quality, comprehensive health care, as does Elmhurst, we can only help about 15 to 20% of what ails people. Because at the end of the day, most of healthcare, most of our health outcomes are not determined by the doctors that we go to and the hospitals that we visit. It is instead dependent on the zip code that we live in, and the communities that are surrounded by pollution, poor housing, poor air. So we need to recognize that, yes, Black and brown folks have been infected at higher rates, have been dying at higher rates, and we had many of our patients die from COVID-19. But to put all the blame on Elmhurst Hospital, like some folks have done, is missing the point, because Elmhurst did extraordinary work, heroic work for the patients that we care for. They put their lives on the line every day to try to save people from this pandemic, as did my staff. And we just all need to recognize that what we can only do so much. There are limits to what we can do, because the situation we find ourselves in, the reason for the disparities that we see in racial and ethnic minorities, is not about the health care, the quality health care that we're able to provide people, but it is unfortunately a function of the systemic racism, institutional racism that is rampant throughout this country and unfortunately throughout this city. So as much we can do, and we do well. Plaza del Sol, Elmhurst Hospital, we truly are providing the comprehensive health care, the quality health care that people deserve. Because at the end of the day, health care is a right, not a privilege. And we work every day to make that a true statement. We do, and Hospitals does. I truly and fervently believe that. But yet, we are stuck in a situation where we can only accomplish so much without other factors being changed. And that is what we need to continue to work towards, changing those other factors, making sure people have clean air, clean water, no lead in their water, good housing that's free of roaches and rodents. If we can accomplish that, if we can make those changes that are much larger than dealing with just the health and hospitals, that will improve the outcomes that health and hospitals have. It will improve the lives and the quality of lives that people have. And by the way, our outcomes for morbidity or mortality for diseases like COVID-19. So until we are able to address those factors, it is difficult to fathom that we will be able to change the perception that we somehow are providing substandard medical care, because that is not what is happening. We are providing excellent medical care, but we are hindered by other factors that are causing issues. I thank you very much for your time. I thank you for your heroism every day. God bless and Godspeed.
Thank you very much for your comments. The next speaker is Carlos Cortez, the Community Advisory Board Chair for Elmhurst.
Hi, good evening. Again, my name is Carlos Cortez. I am the chair of the Community Advisory Board to the Health and Hospitals Elmhurst facility. Before I begin my prepared remarks, I do want to express sincerely my thanks. I know it's been said before about the heroism, the dedication, the commitment, the entire staff, all the workers at Elmhurst Hospital during the peak episode of the pandemic. You know, they really sacrificed themselves. They were stars before this pandemic, but in my mind, they are supernovas now. They've done heroic work. At a recent meeting I was attending at Elmhurst, a number was given that 1,600 COVID patients walked out of Elmhurst during the pandemic, during the peak. I believe it's more than that, because the people that they've saved, not only were those individuals saved, but also a lot of heartaches and pain of the families of those persons. So thank you very much to all the medical staff, the administrators, and all the support staff at Elmhurst. On behalf of the CAB members, and the communities that the CAB members represent, we sincerely and deeply appreciate all your efforts. So let me begin by first, stating that it is indeed a pleasure for me to be here on behalf of the CAB to report on the important work that Elmhurst Hospital has done in 2019 and 2020. I say we because I've been very honored to have been a part of their efforts in implementing a strategic plan that has been going on for the past 5 years, I believe. This strategic plans is developed by a multidisciplinary team that's comprised of Elmhurst clinical, labor, nursing, and administrative leaders. And I've been very fortunate to represent the CAB in this effort. And we come together to develop a strategic plan for the future of Elmhurst and for the future of all the services that Elmhurst provides. This plan incorporates community and staff needs assessments formulated during our focus groups that we call SWOT, SWOT, which stands for Strengths, Weaknesses, Opportunities, and Threats. I want to report today that some of the significant accomplishments that have been made as a result of the strategic plans, and I am confident that they will yield effects of positive effects for our community. To begin, for example, the catchment area that Elmhurst Hospital serves has a high incidence of people dealing with the heart disease and strokes. Elmhurst has been working very hard to educate its patients about the link between these diseases and diet, exercise, nutrition, by emphasizing physician-patient partnerships that prioritize blood pressure control and have patients play an active role in maintaining their health. I'm happy to report that these tremendous efforts have been recognized nationally. As Dr. Katza mentioned earlier, many of the facilities receive awards, and Elmhurst is at the forefront of these awards. For several years in a row, the cerebrovascular stroke program at New York City Health and Hospitals, Elmhurst has been awarded the American Heart Association's, American Stroke Association's Get With the Guidelines, Stroke Gold Plus, Target Stroke Elite Plus, and Target Type 2 Diabetes Honor Roll Awards. Due to the hospital's use of evidence-based tools to track and measure success in treating patients and improving patient outcomes, Elmhurst has also been certified by the Joint Commission as a primary stroke center and is developing plans in the very near future to become a comprehensive stroke center, a resource that is sorely needed here in Queens. We don't want our patients to have to travel to Manhattan to receive services and alleviate their stroke issues. Elmhurst also received a well-deserved honor last year when it was nationally ranked by the U.S. News and World Report for 2019-2020 as one of America's top hospitals for the treatment of hip and knee COPD and heart failure patients. Medical professionals know that to be nationally ranked on a specialty, a hospital must provide exceptional care for the sickest, most medically complex patients, which of course we know Elmhurst excels at given our patient population. The hospital also received recognition from U.S. News for its COPD and heart failure programs for 2020 and 2021. The hospital's nursing team is working very hard to achieve magnet designation from the American Nurses Credentialing Center in recognition of Elmhurst's tremendous efforts to enhance patient care and innovative nursing practices. As a longtime community resident, I've also been really thrilled to see all the physical changes and improvements that the hospital has undergone. I've been pleased to take part in many of these groundbreakings for much needed projects like the emergency department renovation and the new ambulatory surgery center.
Sir,
You know,
would
I've
you
been
please conclude your
since,
remarks?
yes,
Your time is up.
thank you. These are great accomplishments, and I'm very proud to call myself a member of the Elmhurst Care Team and the community that they so richly serve. Our leader, Mr. Rocha, medical director, Dr. Jasmine Marshapur, and the rest of the hospital leadership and staff are committed to my community, which greatly needs and deserves the outstanding medical care that has been provided over the years. Thank you so much.
Thank you very much. Appreciate your comments. The next speaker is Luisang Tamang, also a Community Advisory Board member in Elmhurst.
Hi, good evening, everyone. My name is Lushang Tamang, and I'm a member of Elmhurst Community Advisory Board. I joined the board 2 years ago and currently sit on the legislative committee. Thank you for the opportunity to speak today about NYC Health and Hospitals Elmhurst facility. I'm originally from Nepal. I'm very active in the Nepali community in Queens, and I have served as the president of the Federation of Indigenous Peoples of Nepal in America, which is a non-profit organization that works for a better future for Nepali New Yorkers. I'm also a co-founder of the South Asian Convention in New York City, which is an event aimed at empowering South Asian Americans and engaging them in community activism. I decided to join Elmhurst Community Advisory Board because of my concern that for the growing needs of my community related to health and social welfare. Through my work with the Community Advisory Board, I have been interested to learn about the various ways that Elmhurst Hospital is engaging with the community to provide the care that it needs despite the pandemic. These initiatives include managing a walk-in COVID testing center. Elmhurst was the first hospital in the country to test patients regardless of someone being symptomatic or asymptomatic. To date, the hospital has tested over 25,000 community members and is working to assist the Department of Education with the testing needs. The hospital also acquired a customized trailer outside of the emergency department to create the additional testing space the community needs. The introduction of tele-visits, social distancing, and appropriate personal protective equipment. The hospital's primary care and specialties clinics have made a huge effort during the pandemic to engage and stay connected to patients through telehealth and video visits. These efforts are ongoing. In addition, since mid-June, when in-person visits were reestablished throughout ambulatory care, the hospital has made a concentrated effort to provide care in a safe manner. For instance, all patients must wear face masks or face coverings at all times. All staffs are required to wear appropriate personal protective equipment while treating patients. All patients and visitors at entrances to clinics are met with temperature checks, and clinic windows now have clear protective barriers. There are also greeters who assist patients and visual cues noticeable throughout Elmhurst Hospital to help maintain social distancing, limiting visitors and staggering patient appointments. All patients are now pre-registered before appointments through phone calls or contact made by ambulatory care team members. Appointment times in clinics are now staggered so as to avoid crowded waiting areas. And the hospital continues to enforce a limited visitation policy for outpatient appointments that includes one parent in all pediatric services and one companion for disabled patients. Additional safety measures and precautions. Elmhurst Hospital renovated space in its community medical centers, specialty clinic area to create negative pressure exam and procedure rooms to safely provide services to patients. Procedural areas now have special venting. Rooms are also cleaned and sanitized frequently throughout the day and in between patients. In addition, the hospital has continued to have a sharp focus on patients' satisfaction initiatives during the current crisis. For instance, Elmhurst Hospital started the Caring Connections program during the COVID surge to allow the patients to connect to their loved ones by video call whenever they are not able to visit or when the visitation restrictions are in place. During the lockdown, Elmhurst was able to connect patients with their family members, not only in the US, but also abroad, averaging about 280 video calls per day. Elmhurst continues its Caring Connections program for patients staying in isolation rooms and is offering it to family members who can't come during visitation hours. Many of our inpatient units have been completely renovated since the COVID surge. The hospital's escapes rate the hospital top box rating has reached several monthly all-time high scores. Elmhurst recently closed the highest quarter ever at 73% of top box rating for the second quarter of 2020, putting Elmhurst in the 55th percentile nationwide. Same time last year, it was 11th percentile. In the 81st percentile for New York State and 99th percentile for New York City Health and Hospitals. I am happy to see the efforts that Elmhurst is making during the COVID-19 healthcare crisis to improve patient satisfaction and ensure that care is being delivered in compassionate and safe ways. I look forward
Conclude your remarks. Thank you.
to look forward working closely with Elmhurst leaderships. Thank you again for your time and patience.
Thank you very much. Thank you. The next speaker is Sinead Wadsworth, Area Standards Rep for the New York City District Council of Carpenters. No, Sinead Wadsworth, no? Okay. Next speaker will be Peter Amato, Community Advisory Board member, also from Elmhurst.
Good evening. My name is Peter Amato, and I am currently a member of the Community Advisory Board at Elmhurst. I have a long history with the hospital, having worked at Elmhurst for 32 years and retired in 2000. In the years since my retirement, I've been honored to serve on the Community Advisory Board and have been witness to all the phenomenal work this hospital has done and continues to do so in support of the community's healthcare needs. To me, there has been no greater evidence of the need for hospitals like Elmhurst, an institution that takes care of everyone, regardless of their background or economic situation. I was not in New York during the height of the COVID-19 outbreak in March and April. Like many other people around the country, I watched the news in horror at the devastating toll that the disease was having on Elmhurst. I was greatly concerned how the hospital would be able to cope with treating so many critically ill patients at once. As a former employee of Elmhurst, I also empathized with those I had worked with for so many years as they fought back against a deadly disease that seemingly came out of nowhere and forced everyone to quickly adapt to treat a community that desperately needed help. In normal times, I know how hard the staff works to provide high-quality care to patients and how challenging it has been over the years to provide that care with often limited space and resources. This has been particularly true of the challenges facing Elmhurst's emergency department, which is one of the busiest, not only in New York City, but in the nation. Add a pandemic on top of that, and you quickly begin to appreciate the enormity of the task Elmhurst had at the start of the pandemic. So I have to commend the entire staff, physicians, nurses, administrators, and support personnel for how well they performed and how many lives they saved. It has truly been inspirational, and I have never been prouder to be part of the extended Elmhurst Hospital family. I also want to pay tribute to a very special person, a member of the Elmhurst family who unfortunately passed away during the height of the pandemic. Derek Braswell, a manager in materials management who I originally hired, died in April. Derek was a wonderful person who, and I will quote from an article recently written about him, put thought and care into everything he did. He loved his job at Elmhurst. He was always curious to learn and grow. He always made you feel at home in his presence. Derek was a dedicated employee who represented the best of Elmhurst. He was active in the community as vice president of LP Fans Youth Organization and as a Little League baseball coach. He will be sorely missed by all of us. Let me conclude by thanking all the senior leaders at Elmhurst. Chief Nursing Officer Joanne Gull, Regional Medical Director Dr. Jasmine Marshapur, and Elmhurst's CEO, VP of New York City Health and Hospitals, Mr. Israel Rocha, and Chief Operating Officer Wayne Zimmerman for outstanding leadership in guiding us through an emotionally devastating time and making sure that Elmhurst has the resources to continuing care for our community throughout the COVID-19 crisis. I look forward in continuing to support them through the efforts and advocacy of the Community Advisory Board. Thank you very much.
Thank you so much for your comments. The next speaker is Doreen Gatinas, an auxiliary member from Elmhurst.
Hello?
Hello, we hear you.
Hello, good evening. My name is Doreen Gatanis, and I'm a proud member of the Elmhurst Hospital Auxiliary. Before I joined the auxiliary, I worked at Elmhurst for 38 and a half years as a registered nurse. I worked in the hemodialysis unit and was the head nurse from 2000 through 2017, after which I retired. I also served as president chair and vice chair for the New York State Nurses Association local bargaining unit at Elmhurst and was a trustee for the New York State Nurses Welfare Fund. I was involved in organizing fundraising at Elmhurst for the National Kidney Foundation and conducted kidney walks in support of our Elmhurst patients. Throughout my career at Elmhurst, I saw how important it was for the hospital to have additional funding to enhance patient services and provide support for programs that would promote the health of the surrounding community. So after my retirement, I was excited to get back to the hospital by joining the Elmhurst Hospital Auxiliary, and I'll briefly talk to you about what we do. For over 85 years, Elmhurst Auxiliary, which currently consists of a small group of dedicated volunteers, has raised funds to support the hospital and its patients. Our mission is to fundraise for New York City Health and Hospitals in order to support Elmhurst's commitment to providing innovative quality health care for our communities, regardless of the patient's ability to pay. We accomplish this by providing avenues for individuals, corporations, and philanthropic organizations to partner with us and support the hospital financially. We work closely with hospital leadership to decide what the hospital needs are and how funds exist. For instance, in recent years, we have helped the hospital purchase new anesthesia machines and equipment for our labor and delivery unit. We have supported health and education through community events such as the hospital annual pediatric and back-to-school fairs, and provided gifts for our neediest pediatric patients through our support of the hospital's Healthy Halloween celebration and annual Winter Wonderland toy distribution. We helped organize fundraising events such as our annual gala, which this year will be virtual to be held in late October, as well as many other small fundraisers and raffle events throughout the year. The auxiliary members also support the hospital by volunteering at many community outreach programs. I want to close my remarks by saying a special thank you on behalf of the auxiliary to the many individuals and organizations from around the country who have supported the staff and patients of Elmhurst during the COVID-19 pandemic. As we know, the past 6 months have been especially trying for the hospital as it has worked to treat patients suffering from this terrible disease. We have received an outpouring of support that has truly been overwhelming. From the thousands of cards, posters, drawings, and messages of support, including a huge thank you sign erected across the street from Elmhurst, to donations of food for our hospital staff who worked long hours, to the shipments of masks and gloves and other PPE Elmhurst received, plus many small fundraisers held on our behalf. We received an outpouring of support from the wider community that has left us and the Elmhurst Hospital staff, both thankful and humble. Words can't begin to express the depth of gratitude we feel. Thank you so much, so very much, for the opportunity to speak to you.
Thank you very much. The next speaker is Anthony Andrews, the Community Advisory Board Chair at Queens.
Thank you. Good evening, everyone. I'm very grateful to be here tonight to address the board members of the Cape City Health and Hospital Corporation. I'd also like to acknowledge our president, Dr. Mitch Katz, and Ms. Israel Rocha for the fine work that they've been doing as the president and CEO of the Queens Health Network, respectively. These past few months, several months, the coronavirus epidemic has taken a toll on the residents of Queens. As you know, Queens and Elmhurst Hospital were at the very epicenter of this pandemic, and New York City became the epicenter of the world. Fortunately, we came together with the great work of our doctors, nurses, and staff, and all the volunteers and people who came in from out of town, from other cities, other states. We not only endured, but saved thousands of lives. But indeed, without the leadership of Mr. Rocha and the leadership of the teams of both hospitals, things could have been much worse. Mr. Rocha has taken on the role of the CEO of the Queens Health Network and provided steady leadership in the wake of the promotion of my close friend and former CEO, Chris Rocha, and performed truly admirably despite the difficult challenges created by the pandemic. In fact, in the months since the initial crisis was at its peak, Mr. Rocha indeed has continued to make both patient experience and staff engagement key priorities in the quest to bolster Queens Hospital Center's recognition as one of the most advanced healthcare facilities in the borough and a welcoming place for its patients. Let me just share a few things that we believe will benefit Health and Hospital Queens and allow it to be successful as we rebound from this pandemic and get ready for the possible second wave. One of the first challenges we faced was enabling the hospital to resume a semblance of normalcy, and trying to get people back to the hospital has been a challenge. Once the coronavirus ceased, we began to reach out to community residents to let them know and to advertise the hospital and to make sure that people understood it was safe to come back. We created an enhanced setting for ambulatory care services to fully reopen the patients, which included new procedures and precautions designed to keep patients and staff safe. The reopening paved the way for all patients and staff to be required to wear face masks and other PPE at all times. We have separate COVID and non-COVID treatment areas now. We've established pre-registration calls prior to in-person appointments to reduce check-in times. We also plan to limit the number of visitors for clinic visits, including one parent and all pediatric services. And we're making sure that only one companion can be there with disabled patients. Patients can also check in with their doctor and nurse care teams by having access to a free Epic MyChart account, which can be accessed by a smartphone, tablet, or computer. MyChart enables patients to message their provided care team, review upcoming scheduled appointments, receive clinical advice, and request medication refills, and also to view test results. Mr. Rocha has really made sure to recognize the work of the employees also. Recently, he distributed T-shirts with the hospital's official logo and the phrase, New York's Fearless, a nickname that aptly describes the bravery and heroism displayed by all of our health and hospital frontline employees and essential workers. And the workers were invited to wear the T-shirts and enjoy a picnic on the campus grounds as thanks for their dedication during the pandemic. In mid-March, just as we were about to unveil the donor wall of the hospital atrium to celebrate the enduring legacy of our former Queensborough President Clay Schumann, we had to postpone the event as the pandemic took hold of our borough and our city. Then, just last month, we lost Claire. She had been Queens Hospital's fiercest champion for so many years and indeed played a role in making sure the hospital wasn't closed at one time. Having played a major role in rebuilding and modernization of this facility, we wanted to make sure we honored her. Claire began her career as a nurse working at the hospital when she met her husband, Dr. Melvin Schumann. Claire's dedication to quality health care and love of nursing led her to fight to preserve public hospitals from the threat of privatization in the mid-90s. A rugged determination resulted in securing more than $150 million in capital funding for major modernization projects in the upgrading of both Queens and Elmhurst hospitals. She was also instrumental in the subsequent establishment of the Queens Cancer Center in 2001, where Dr. Kennedy does an excellent job with her staff. We wanted to make sure we did everything to honor her legacy, and so we have a mural that we created for Claire, a donor wall which will be unveiled in October. But as tragic as it was in many ways, the pandemic created an opportunity for enormous generosity from neighboring businesses and community organizations. So many friends of Queens Hospital came through for us, providing ample amounts of PPE for our workers, and even meals for those who showed up to work each day, fighting the pandemic against all odds. But of course, we would not have been able to get through this ordeal without the support of Dr. Katz and his team, who, when we were faced with enormous odds, stood firm in their resolve to make sure that we didn't collapse amidst the enormity of the challenge. What most people don't realize is that while they were doing this, they made sure to check on each of the board members. And when they heard I'd been sick for a while, convinced me to be tested. The result was a call to Mr. Osha and an immediate test by Dr. Dave Olson, who oversees our emergency room. They confirmed my worst fear. Unfortunately, I contracted the virus. But if not for Mitch, Matt, Deborah, Israel, Dave, and Cleon, I might not have been here to give testimony today. I could be here all night, but that's not truly necessary. You have my testimony, and I know that you all understand how I feel as the chair of the Council of CADS and the chair of Queens Hospital Center, or Health and Hospital Queens, as we now call it. I want to thank our CEO and our team at Queens and all the staff and Mitch at 125 Worth for all the work that they do and for allowing me to testify. I look forward to continuing our work this year as we continue to bring public hospitals the attention they need and to serve the communities which they were intended for. Thank you.
Thank you so much for your comments. The next speaker is James Bonaparte, a Community Advisory Board officer from Queens. Okay, not on the line at this time. Let's move to Malika Carteron, also a Community Advisory Board member at Queens. Malika, can you hear?
Good evening.
Great, thank you.
Can you hear me?
Yes.
Good evening. My name is Malika Carteron. I am a member of the Community Advisory Board, CAB, and New York City Health and Hospitals, Queens. Thank you for the opportunity to speak this evening regarding the CAB's use of technology during the corona pandemic. Over the last 6 months since the pandemic took hold, the Queens Hospital Community Advisory Board has significantly enhanced its use of technology to keep members informed and engaged during this difficult time. We have relied upon the use of WebEx meetings as a way of maintaining our monthly meeting schedule and accelerating communication among our membership. At the same time, Queens Hospital has increased its use of technology in the form of iPads to enable families to speak with loved ones who were in the hospital being treated for COVID-19. In fact, the hospital established a COVID-19 patient family virtual visitation program as was done in all of health and hospital facilities, to allow family members to connect with loved ones being hospitalized during the height of the pandemic. By introducing the virtual visitation program, the hospital found a way to circumvent the barriers of visitation created by the virus and to provide an entryway for patients and families to see and communicate with one another through these use of electronic devices. As in all health or H&H facilities, the virtual visitation program was conducted in Queens Hospital Intensive Care Unit, Emergency Department, and Med-Surg Unit using hospital-issued electronic tablets or iPads, enabling patients and their families to have FaceTime visits. In order to ensure patient safety, a hospital staff member was assigned to facilitate the virtual visit and maximize the use of personal protective equipment, or PPE. The staff member was also there to assist with the family's visit and allow them time for privacy. Of course, throughout this alteration to normal procedures, the hospital was operating under every imaginable safeguard to ensure the virus would not be spread. For example, throughout the course of these virtual visits, hospital staff donned their personal protective equipment, followed set protocols, could not bring anything inside the unit except their electronic tablet, could not place the electronic tablet anywhere, and could not touch anything. Throughout the most critical period of the pandemic, from mid-March to early May, Queens Hospital conducted nearly 300 such virtual visits for patients and their families. As the situation has gradually turned to a semblance of normalcy, the hospital's clinicians are continuing to use televisits so they can provide patients with an appropriate level of care. In early May, Queens Hospital announced the opening of a new cold unit to serve patients who were free of the virus as confirmed by a negative test result within the last 24 hours. This opening indicated the start of a gradual return to normal hospital operations, which is where we are now. As the hospital adjusts and moves forward after the crisis, the new leadership provided by the Chief Operating Officer, Israel Roca, has led to a renewed focus on improving patient care. Through the reopening of the ambulatory care service, has emphasized an increased attention to detail. In reconfiguring the space, the primary imperative has been on the initial terminal cleaning of all rooms and patient areas. The overall process requires full disinfection, from ceiling to floor to include all contents within each space-specific area. Staff on the units continue to wear N95 face masks and don't require PPE as needed, and temperature checks occur at the beginning of each shift. Staff have also been encouraged to get tested both for COVID-19 and the presence of virus antibodies by the way of blood tests. With the advent of the school year underway, Queens Hospital has also agreed to perform appropriate testing for its fellow essential employees from the New York City Department of Education. Teachers, administrators, and other essential DOE employees can take advantage of walk-in testing areas installed in the 164th Street parking lot. No appointment is required, and all that is needed is a valid form of identification and an insurance card if available. Thank you and have a great evening.
Thank you so much for your comments. The next speaker is, I believe, Dorothea McFadden, the Auxiliary President at Queens.
Okay. Hello, everyone. Can you hear me?
Yes.
Okay. Good evening, everyone. I am Doretha McFadden, President of the Auxiliary at New York Health and Hospital Queens. I'm grateful to have this opportunity to address key members of New York City Health and Hospital, our local elected officials, their representatives, community leaders, fellow CAB members, and auxilians alike, all of whom share a concern for the future progress of this great New York City Health and Hospital Queens entire public hospital system. It gives me great pride to serve as president of the Queens Hospital Auxiliary, a position I have held for the past 8 years. The Auxiliary is a voluntary organization whose primary mission is to raise funds that can be used to enhance patient care at Queens. Funds raised by the Auxiliary are used to benefit the hospital via the purchase of new state-of-the-art equipment and medical programs. Over the past 3 years, the Auxiliary has been able to donate more than $1 million for life-saving equipment and vital services for our patients. This includes the defibrillators for life-threatening heart conditions, new stretchers for emergency department, ultrasound-guided bronchoscopy system, an adult patient simulator mannequin for critical care, ultrasound for the NICU, phaco machine for cataract surgery, and a microscope for the operating room. All of us who've been part of the auxiliary and have worked closely with hospital administration through the years have been deeply affected by the recent passing of former Queensborough President Claire Shulman. Claire was a steadfast ally of Queens Hospital for decades, and this evening I'd like to pay tribute to Claire and her lifelong commitment to the survival and improvement of this hospital. Claire built her entire career around contributing to the betterment of her community and specifically to the borough of Queens for the past half century. She began her career as a nurse, working right here in what was formerly known as Queens General Hospital, where she met her husband, Dr. Melvin Shulman. Beginning her time in politics as chairman of the local community board, she became deputy borough president and eventually landed the job of first female Queens Borough president. Yet she did so well that she redefined the job, remaining in the position for the next 16 years. Claire paved the way for two dynamic borough presidents that followed her, Helen Marshall and Melinda Katz. Claire was fiercely determined to ensure quality, comprehensive health care for all her constituents. Her belief in and commitment to Queens Hospital extended to her leading the fight to preserve it when it faced the threat of privatization. We're currently in the midst of planning a virtual unveiling of the Claire Shulman Donor Wall in the Queens Hospital atrium that will take place in October. The Claire Shulman Donor Wall was built to honor the lifetime achievement of a courageous leader and a nurse who fought to protect our hospital's mission, to extend healthcare services of the highest quality equally to all New York in an atmosphere of humane care, dignity, and respect. The Queens Hospital Auxiliary is also in the process of preparing for a major fundraising effort known as Sheila E. Friends and Voices of Hope Concert, supporting New York City's Fearless. This event will be a virtual fundraiser that will take place on the evening of Thursday, November the 12th. In closing, while we all have been experiencing trying time in coping with the pandemic, the Queens Hospital Auxiliary continues to work hard for the people of Southeast Queens and remains committed to fulfilling the hospital's mission of providing high quality, comprehensive health care to all, regardless of their ability to pay. Thank you for giving me this opportunity to share these thoughts.
Thank you very much. The next speaker is Leslie Ramos, the Executive Director of the 82nd Street Partnership.
1 second.
Are you able to speak?
I'm trying.
Okay.
Sorry. Oh, you can hear me. So that is great. I'm sorry. I'm having a little technical problems getting my camera open. My name is Leslie Ramos. I'm the Executive Director of the 82nd Street Partnership. We serve the community in Jackson Heights and Elmhurst, even though our boundaries are confined to 82nd Street between 37th Avenue and Baxter. So we just half a block away from the hospital. I am very grateful to be so close to the hospital because the hospital continuously has been a great partner to my organization in our mission to serve the entire community, to address the needs of the neighborhood, not just of the small businesses, but also of the resident. Pre-pandemic, we were on a mission to help the community get healthy in terms of how they eat their food that they love and they enjoy. as part of that mission, we created a program called a program devoted to help restaurants identify healthy eating options within their own menu, so that way that they can help their clients make healthy choices. This is an innovative program that wouldn't have not been possible without the hospital creativity and commitment to the community. In addition to that, we have scheduled multiple classes in the block just down the street to teach people how to eat healthy food. And in the process, we also fed people in the community. Day in and day out, every event that we have done with Elmer Hospital, be taking blood pressure and advising the community during our festival, the feedback is the same. People feel proud. They are delighted to have the hospital be in their community and also step outside of the walls to help the community. In creating this event, we have partnered with the team in the auxiliary department as well as the community affair. I cannot say enough good things to express how devoted this team is to educate the community, to bring information to the community, to engage the community, and also to find creative ideas of how to be part of the community that they served. It just been fantastic to me, and I hope that the support for community programming, community outreach, community activities continue. Sometimes, we think it's simple to just walk into a hospital, but for a lot of people in working class or an immigrant community, sometimes that task seems, difficult. They think of hospital as places that you only go for emergency or to die. When the hospital comes to the street, you are opening and extending the hands to the community to send a welcome mat for those that don't think about the preventive care. I think from the pandemic, now is more important than ever that we continue to partner in the outreach effort with the community. Those people who are constantly walking by the hospital that might not have a primary doctor or that might not know the need for preventive care and maintenance. So I just wanted to sort of express my support for the work that the community outreach team is doing. The nutritionists have been fantastic, sitting and looking through the menus in our restaurant to help them identify healthy eating options. They have been available to answer our questions, to help the restaurants provide guidance to the community. These are innovative programs that without the community outreach department, the public affairs department, wouldn't happen. We need to change, especially after Elmer's, about how we take care of the community's health needs. We know right now that some of the illnesses, such as diabetes and high blood pressure, that are prevalent in our community, put our people at higher risk. Just on 82nd Street and the corner of 37th Avenue, we lost 3 business owners. We lost people who had been long-standing members of the community. So as long as our hospital is willing to work with us, we are available to continue to spread the message that the hospital is open to all. The hospital is committed to helping change, the way that we take care of our health. So with that saying, I just wanted to.
Yes.
Yes.
Would you please conclude your remarks? Your time
Yes.
has expired.
I just wanted to say I have been very impressed working with Mr. Rocha I wanted to say thank you to him for allowing his staff to work with the partnership to bring creative ideas to deal with access to healthcare and to deal with healthcare needs in the neighborhood. So thank you.
Thank you very much. Thank you for your comments. The next speaker is Tamara Michelle, a community health coordinator with the Queens Public Library. Thank you.
Thank you. Hello, everyone. Thank you so much for this opportunity to say a few words about Queens Public Library's partnership with H&H, which began about 14 years ago with Queens Cancer Center and has continued since. We regularly deliver exceptional programming with Linda Bulone. She is an absolutely incredible research nurse manager there. We also have an extremely rich partnership with Elmhurst. I'm so grateful for this opportunity to publicly thank Atia Butler, the Director of External Affairs and Marketing, who works tirelessly with her team to develop incredible programs for the Queens community and beyond. Since 2016, we have partnered with Elmhurst to bring exceptional health education to Queens Public Libraries. H&H providers are professional, thoughtful, and as a result, their programming for our library customers is outstanding. Numerous providers with various specialties have delivered programs on a broad array of topics, including but not limited to hip and knee pain, concussions, community safety, and accessing care, the Libertas Center for Human Rights, safe sleep and infant safety, emergency preparedness, depression, men's health, cardiology, nutrition, nephrology, CPR and medical simulation, adolescent health, proxies, stroke, various types of cancers, back to school safety, pediatric milestones, and many more topics that are of the most important, of the most urgent importance to various Queens populations. And actually next week, they're gonna be delivering some education on New York City care. These programs have been cardiology, nutrition, nephrology, CPR, and medical simulation. Something echoing?
Sorry.
I think going.
Yeah, go ahead.
These programs have been delivered throughout the borough at community libraries so that Queens residents were able to access the information right in their own neighborhoods in English, Spanish, Mandarin, and Cantonese. In addition, the H&H staff have also welcomed us into their spaces with tours of Elmhurst Green Market and Queens Cancer Center tours tailored with education for our ESOL students. And now, motivated by the current healthcare crisis, and despite the tremendous impact that COVID-19 has had on them personally, our hospital heroes have moved the programming they deliver to a virtual platform to ensure that our Queens communities will still get the information we need and just when we need it the most. So on behalf of Queens Public Library, I want to extend my great appreciation and gratitude to H&H Elmhurst and Queens' incredible and selfless employees for their exceptional service always, but especially this year. Thank you so much.
Great, thank you so much for your comments. The next speaker is Beatrice Moyes Williams, a concerned citizen. Beatrice Williams on the line. Okay, we'll move on to the next speaker. Next speaker is Michael Hurwitz, Director of Grow NYC Food Access and Agriculture.
Good evening, everyone. Can you hear me?
Yes, thank you.
I see the head nodding. It's great to be here. I appreciate the opportunity. I'm someone who showed up on Friday, March 13th for a COVID test and lived 4 blocks away from the hospital for the several months following. And I remain in awe of what this hospital was able to do during this incredible pandemic. I'm also grateful to the hospital for taking a chance on our 10th year together, knowing that there was some concerns about being outside, knowing that there was real other needs that the hospital had presenting, and to really maintain and get back on its feet. We've had an incredible relationship over the last 10 years, and we have a Tia Butler and her team, and the WIC program couldn't be stronger. We're thrilled to be there. We're a little smaller than we've been in years past, but we're still there week in, week out with the freshest, healthiest produce available in New York City, coming from our regional growers. And we're looking forward to the next 20 years. So thank you for your incredible work and all the best in whatever we can do in that partnership.
Great, thank you so very much. The next speaker is Anthony Feliciano. He's the director of the Commission on the Public Health System. Anthony Feliciano, are you on the line? No. Okay. Next speaker is Valencia Clay, an executive assistant at BMO Capital Markets. Valencia Clay. Okay, I'm going to call our last speaker, and then I may call the others one more time. Aylin Liu, SNAP Program Manager.
Hi, can you guys hear me?
Yes, thank you.
Thank you. This is Aileen Liu. I'm the SNAP Program Manager at Public Health Solutions. Thank you so much for this opportunity to for us to speak about our partnership with Amherst Hospital. We work with Amherst Hospital since 2017 to support the community, and we provide SNAP enrollment services for the general public and health insurance enrollment for the aged, blind, and disabled population. I just wanted to say the Amherst Hospital team has been really supportive. It's a very collaborative experience working with the hospital in order to connect patients to the services they need. So far, we assisted 780 seniors for their health insurance and submitted 744 applications. And thanks to this partnership, seniors in the community are happy that we're able to help them to enroll in health insurance at a location that's right in the neighborhood, saving them a trip to HRA. And we have a Spanish enroller. We also assisted 163 families for their food needs and submitted 674 SNAP applications. And at the end, I just want to share a story that's told by our SNAP enroller who works at Amherst Hospital. I remember this patient called me and asked that she needed help to get SNAP because she has 10 years in the US and she didn't know how to apply, how it worked, and didn't know what documents will HRA ask for. She is undocumented and have an 8-year-old son that is a citizen. She's scared to be a public charge because in the future she wants to fix her immigration status. I gave her the public charge 800 number, the free legal services, just to verify everything before she applied for the benefits. I also told her the documents I need to start the application. On a week, she called me back and told me that she was having a difficult time because she lost her job in a restaurant because of COVID. She was basically feeding herself and her son with some savings she had, which is not a lot. She basically told me that she didn't care if she was going to be public charge, but she would do anything so her child could be good. This brought to my attention because I'm a mother and it's true that we sacrifice ourselves so our children will be good. And she was one of the million people that lost their job because of COVID. At the end, I submitted an application for her. It's approved for $194 monthly, and she was connected with a food pantry nearby. This patient is connected to us through an Amherst social worker. Thank you.
Thank you so much for your comments. I'm just going to run over, I'm going to go over a couple of names of people who who had registered but were not on, just very briefly. James Bonaparte, Anthony Feliciano, or Valencia Clay. Okay, they are not on. So this concludes our annual event. Thank you all so much for participating. Oh, I'm sorry, I missed Beatrice Williams. Is Beatrice Williams on now? Thank you, Felicia. Okay, this concludes our meeting. Thank you so much for joining us.